Hello and welcome. Today we're delving into a rare and often complex condition affecting the urinary system, bladder neurofibroma. We'll explore its causes, symptoms, and diagnosis, providing a comprehensive overview of this unusual disease. The exact cause of bladder neurofibroma is not entirely understood. It's generally considered a benign tumor rising from the nerve sheath cells of the bladder wall. While it can occur sporadically, bladder neurofibromas are frequently associated with neurofibromatosis type 1, also known as von Recklinghausen's disease. Neurofibromatosis type 1 is a genetic disorder that causes tumors to grow along nerves throughout the body. In individuals with NF1, genetic mutations lead to the overproduction of neurofibromin, a protein that normally regulates cell growth. This unregulated cell growth can lead to the formation of neurofibromas in various locations, including the bladder. Let's break down the pathophysiology. Neurofibromas in the bladder arise from the Schwann cells, fibroblasts, and other supportive cells of the peripheral nerve sheaths within the bladder wall. As the neurofibroma grows, it can impinge upon the bladder's normal function. This mass can obstruct the flow of urine, irritate the bladder lining, or even affect the surrounding structures. The size and location of the neurofibroma determine the severity of the symptoms. The presence of the tumor disrupts the smooth muscle contractions of the bladder, leading to urinary frequency, urgency, and potential difficulties with complete bladder emptying. In some cases, the tumor can also cause bleeding into the urine. Bladder neurofibromas are relatively rare, particularly in individuals without a known diagnosis of neurofibromatosis type 1. The exact incidence is difficult to determine, as many cases may go undiagnosed or are discovered incidentally during evaluations for other urinary issues. In patients with neurofibromatosis type 1, the prevalence of neurofibromas in various organs is higher, but bladder involvement remains a less common manifestation of the disease. It affects both men and women, but precise demographic data on bladder-specific neurofibromas are limited due to its rarity. The symptoms of bladder neurofibroma can vary depending on the size and location of the tumor. Common symptoms include urinary frequency, meaning the need to urinate more often than usual; urgency, which is a sudden, compelling need to urinate; dysuria or painful urination can also occur. Hematuria or blood in the urine is another potential symptom. Difficulty with urination or urinary retention may develop if the tumor obstructs the bladder outlet. In some cases, patients may experience lower abdominal pain or discomfort. It's important to note that these symptoms are not specific to bladder neurofibroma and can be indicative of other urinary conditions, necessitating thorough evaluation. Diagnosing bladder neurofibroma typically involves a combination of imaging studies and tissue biopsy. A cystoscopy, where a small camera is inserted into the bladder, allows direct visualization of the bladder lining and any abnormalities. Imaging studies like CT scans or MRI scans can help determine the size, location, and extent of the tumor. However, a definitive diagnosis requires a biopsy, where a small sample of tissue is taken from the tumor and examined under a microscope. This microscopic analysis can confirm the presence of neurofibroma cells and rule out other potential causes of the bladder mass. While bladder neurofibromas themselves are generally benign, they can vary in their microscopic appearance. Some may be more cellular than others. However, the primary distinction lies in whether the neurofibroma is associated with neurofibromatosis type 1. Sporadic cases, occurring in individuals without NF1, tend to be solitary, whereas in patients with NF1, multiple neurofibromas may be present throughout the body, including potentially within the bladder. The treatment and management of bladder neurofibroma depend on the size, location, and symptoms caused by the tumor, as well as the patient's overall health. In some cases, if the tumor is small and asymptomatic, careful observation may be sufficient. However, if the tumor is causing significant symptoms, treatment options may include transurethral resection, where the tumor is removed using instruments inserted through the urethra. In some instances, partial cystectomy, or surgical removal of a portion of the bladder, may be necessary. In patients with neurofibromatosis type 1, management also involves addressing other manifestations of the disease and ongoing surveillance for new tumor growth. Regular follow-up appointments are crucial to monitor for recurrence and manage any potential complications. Currently, there are no specific preventative measures for bladder neurofibroma, especially in sporadic cases. For individuals with neurofibromatosis type 1, genetic counseling and early screening can help identify and manage potential complications, including the development of neurofibromas. Maintaining a healthy lifestyle and addressing any urinary symptoms promptly can also contribute to overall urinary health. The prognosis for bladder neurofibroma is generally good, particularly if the tumor is benign and completely resected. However, recurrence is possible, especially in individuals with neurofibromatosis type 1, necessitating long-term monitoring. Research is ongoing to better understand the genetic and molecular mechanisms underlying neurofibroma development, which may lead to more targeted therapies in the future. Recent advances in molecular diagnostics may also help in identifying individuals at higher risk for recurrence and tailoring treatment strategies accordingly. Furthermore, clinical trials are exploring novel therapies for neurofibromatosis type 1, which may have implications for the management of bladder neurofibromas in these patients. Thank you for joining us in learning about bladder neurofibroma. We hope this information has been helpful.